Hi, I'm Dr. Douglas Harrington, the Chairman and Volunteer Medical Director for the Garda Heart Foundation, which is a 501c3 not-for-profit. What I'd like to talk to you about today is some of the symptoms that are associated with COVID and why they happen. And for those of you that don't know, the virus itself can't get into your body unless it binds to a specific receptor, like a lock and key. It's called ACE2. It turns out that the majority of those receptors are on the lining of your arteries and in the muscles surrounding the arteries, which is why those organs that get the most blood flow, like the lungs, the heart, the brain, the kidneys, the liver, are most damaged by COVID, and that's why you get the symptom complex you see. The interesting thing is that we have a cardiac test. It's called the PULS cardiac test, which is kind of like a check engine light and early warning system for coronary artery disease, which detects damage to the lining of your arteries. And what we found is that that same test, which was originally designed to prevent heart disease, can now be used to track the course of COVID in patients by quantifying the damage to the lining of their arteries and documenting that they are getting better, because some of the long haulers persist with elevated inflammation in their arteries. So remember the PULS cardiac test, that's PULS. You can go to the website pulstest.com, and there's a wealth of information there. And you may, if you've had COVID or you're just recovering from COVID, you may want to consider getting the test to determine what level of injury to the lining of your arteries still persists.